Hi, this is Dr. Homer Lim, and you're listening to your Holistic Health Podcast. So, in this episode, we'll be introducing on what is holistic health and its difference to conventional medicine, and why we here at Akesis Holistic Clinic strongly advocates the holistic approach to a patient's condition.
What is holistic medicine? What's the difference between holistic medicine with the other types of medical principles that is very common among what we offer now? Actually, when we say holistic medicine, we are actually dealing with the person as a whole, meaning you not only treat the physical symptoms, you don't treat just the cold or the cough or the heart disease or the chest pain. You also have to treat the cause, the root cause. So it could be maybe because they have a poor lifestyle, okay, or they have a poor or bad eating habits, no? So when we say holistic medicine, we're addressing not just the symptoms, we're also addressing the root cause. We're also addressing the not only the physical but also the emotional, psychological aspect of the person. So that's what we mean by holistic. So we approach the problems on a not just on the symptoms. We actually go to the root cause, no, as compared to, of course, what there are other forms of medicine like complementary medicine or integrative medicine or alternative medicine. So most of these complementary or alternative medicine do address the holistic aspect of the disease, okay, as compared to conventional medicine. Of course, it's very symptom based or symptom relief rather than actually addressing the root cause. For example, would be if you're hypertensive, then you just give an anti-hypertensive drug. When we say approaching it holistically, then we also have to address what are some of the causes that would increase their blood pressure. No? Number one of it really is stress. A lot of people keep on pointing out it's the food, it's the amount of salt, but actually a lot of this is due to stress. Stress from what? Could be stress from work, stress from home, stress from not being able to sleep well at night. So these are some of the contributors for your hypertension. So that's how we approach the disease or the problem when we say holistic form of medicine, no? So I think one of the things that is lacking in terms of conventional medicine is really how to address the holistic aspect. A lot of times, doctors, when they say, I mean, in the hospitals, right? So when you have heart problems, you go to cardiologist, right? When you have diabetes, you go to a endocrinologist. So when you have kidney disease, you go to a kidney specialist. But and then you at the end of the day, you end up with more than 20 medications or drugs, right? So I think so when we do assessment, when we do their treatment programs, so we address the root cause. Then if you address the root cause, then of course your problems with regards, example would be, perfect example would be diabetes. Diabetic patients will have problems with their sugar. Eventually their heart, their kidneys, their nerves will also be affected. So if you are diabetic patients, then you have to go to all the different specialists, your neurologist, nephrologist, diabetologist, cardiologist, right? So then it becomes a more taxing issue because then you have to see four different doctors at four different times of the month, right? So when we say holistic, we look at the root cause, we address the root cause, then we address the root cause, then all the symptoms, all the problems relating to that will be addressed better. So if your sugar is properly addressed, not just by medicine, but actually taking, a proper low sugar, or what we call low glycemic index foods, then of course your sugar will come down. Your sugar come down, then your kidney issues, your nerve issues, your heart issues will eventually also be addressed, right? So this is what we really want to inform the public, is that we when we want to address a certain disease, we're just not taking the drugs just to address the symptoms. You address the symptoms, but does not really cure you or reverse the disease. So when we try to treat it, we reverse, meaning we put that person or that organ back to its healthiest form, rather than just giving medicine to relieve the hypertension or to lower the blood sugar, but it doesn't really address the problems of what really caused that issue. So somebody asked, from naturopathic living, what treatments can we do to help reduce the symptoms? Uh, that's a very difficult question to answer, because that's a very broad question. So we have to be more specific. So that when we do treatments, actually, we aside from reducing the symptoms, of course, we also try to address the root cause. So there are many treatments out there that are very, very good, whether it's what we call alternative or complementary, or even conventional. No? But again, we just have to, how do you say, we just have to combine it together in such a way that it would impact the person in reversing their issues. No? Okay?
So that sums up our quick introduction to holistic health, and I hope you do come back in our next few episodes. If you do have questions or you want to schedule for consultations, you can visit our Facebook and Instagram pages. That's at Holistic Health. Thank you. Good day.